Good morning, everyone. It's time now for a Henry County Health Center FYI. And this morning, in honor of September being Suicide Prevention and Awareness Month, we're going to discuss the importance of mental health and wellness in older adults. And on the phone, speaking with me today, is a behavioral health professional, Chris Betsworth. And you work at Henry County Health Center Senior Life Solutions Program. Hi, Chris.
Good morning. Thank you for having me.
First, why don't you just tell us a bit about yourself and Senior Life Solutions?
You bet. As you said, my name is Chris Betsworth, and I am the program therapist here at Senior Life Solutions. We are a Henry County Health Center program that provides mental health services to individuals who are 65 and older who might be experiencing depression or anxiety. And as the program therapist, I'm responsible for providing therapy to our patients through group, individual, and family sessions. Additionally, we have Chastity Lang, who is our program director and also serves as the nurse. And we also have Jess Landon, who is our office and patient coordinator, and she provides administrative and clerical services to the program and provides support to our patients.
So with that, let's talk about suicide prevention. What is Suicide Prevention and Awareness Month?
Certainly. Each year during September, Henry County Health Center Senior Life Solutions and others work together to bring awareness to suicide prevention. It's by raising awareness and educating folks about the signs that can indicate someone is having suicidal thoughts or are possibly in danger of attempting suicide that we can help prevent suicides from happening. So Suicide Prevention and Awareness Month is really a time to bring greater awareness of how to help those that may be at risk.
How can people get involved during Suicide Prevention and Awareness Month?
Help us spread the word through awareness, support, and really reaching out to others. I think some of the most important things are to have open conversations, for folks to become willing to engage in conversations about suicide prevention. Do regular check-ins with family and friends to see how they're doing, and also learn the warning signs to watch for that could indicate a friend or a family member might be in crisis.
Yeah, Chris, what are those warning signs of suicide?
While they can vary from person to person, some include depression, having prior suicide attempts, making statements of really feeling hopeless or just no longer having interest in the future. It can be just really feeling you've lost your sense of independence or sense of purpose. A recent medical diagnosis, really isolating oneself or withdrawing others. And then certainly a risk factor can be having access to lethal means, which could be firearms or other weapons. If we ever notice sudden personality changes or increased alcohol or medication misuse or use of other substances, those are all things for us to be aware of and look out for. And then especially if a person begins making more clear verbal statements, such as you'd be better off without me, or no one would miss me if I wasn't around anymore, or directly talking about suicide or killing themselves. Those are all things, again, for us to really be aware of and just engage in an open conversation about.
That's probably the key, and that's what can be so difficult about it for people is to, figure out what to say. What can we do to support someone that we know and love who's struggling with suicidal thoughts?
Yeah, and this really is the hardest part in it, but it's really the key to this, is ask. And you can ask the question just very directly, are you thinking about killing yourself? And while that's not an easy question, we know that studies show that asking folks who are at risk if they are suicidal does not increase suicides or suicide thoughts. And it actually, for a lot of folks, is relieving, because finally someone is asking what they're going through. So taking that hard step, just being courageous and asking it directly, can really have a positive effect. And then, keep the person safe. If they do have access to firearms, ask if they'd be willing to let you hang on to them or give them to another safe person who could safely store those for them or get them locked up. And again, while it's not always easy, asking that at-risk person about a plan to keep them safe and what steps you can help them with really does make a difference. And a lot of it is just being there to listen carefully, learn what the person is thinking and feeling. And research really does show that acknowledging and discussing suicide actually can help reduce rather than increase those thoughts. And then, obviously, the friend or family member may not know where to go next. So helping them connect with another service that can provide that next step is critical here. And we have the National Suicide Prevention Lifeline. That is now that 3-digit code of 988. You can simply pick up the phone and either call or text 988, and you will be directly connected to a trained professional like myself who can provide additional support right there over the phone. And oftentimes, simply having that phone support can be really, really helpful. And then if further steps need to be taken, such as going to the local emergency department, that's certainly something that can be guided from there. And then lastly, I would say for that friend or family member, stay connected. Staying in touch even after that crisis has been resolved is really critical to continue providing that support to your loved one or person you care about.
So why is it important to talk then, switching from maybe just suicide to mental health and wellness specifically in older adults?
Symptoms of depression and anxiety often go unnoticed. And, the older adult who may be experiencing these feelings oftentimes thinks that this is just a normal part of aging. And, our older adults, population of older adults is growing faster than ever. And I really want to get the message out there that you don't have to feel that way. It doesn't have to become the new normal. And there's some different research out there that shows there's really a high number of people over 65 who believe what they're experiencing is just part of getting older. And what we want people to know is that you're not alone in believing that, and there are ways to restore quality of life, and it doesn't have to be part of the aging process.
Maybe talk a little bit about those challenges that older adults face as they age. How do those challenges affect their mental health?
Mm-hmm. And we're going through a lot of significant life changes as we age, and feelings of sadness, guilt, hopelessness, worthlessness. Sometimes these can occur due to some of the different common life transitions that folks experience. By these, I mean retirement. The kids are growing older, having families of their own. Your physical abilities might be different than they used to be. You might be in a new home environment, have left your home of many, many years perhaps. You've lost loved ones or feeling more dependent on others. These are some of the life experiences and transitions that many people go through, and they can often be painful and very complex. We can sometimes get stuck, though, in those really intense feelings of sadness or guilt or hopelessness. And while those life transitions themselves are typical and normal processes that many people go through, the intense feelings associated with them don't have to stick forever.
Yeah, I think that's the key. A lot of older people might be reluctant to talk to loved ones or primary care doctors about the symptoms, the mental health distress they're going through. Why are older adults so reluctant to talk about that? The changes in mood, the lack of sleep, the trouble eating, all of those things.
Sure. First off, I would say that physical symptoms are typically the most apparent and recognizable. It's easy to see and explain, what we're physically feeling. Headaches, stomach aches, constipation, not feeling as hungry, or maybe my appetite's greatly increased, or I'm having trouble sleeping. I'm feeling tired all the time. However, older adults often don't necessarily associate those sorts of physical symptoms with being possible indicators of a mental health issue. And what I would add in there is a treatable mental health issue. And it's not just older adults that have difficulty talking about this. I find people at all ages can have that difficulty. It's hard and painful to bring up some of the thoughts and feelings we can have. Often people assume they're having difficulty with one's mental health is a sign of weakness and somehow different from having any sort of other medical issue. However, those same things that we might go in and talk about physically may also be connected to some of those thoughts and feelings that we're having. And so, again, it comes back to, just like with suicide awareness and prevention, is becoming willing to have that conversation and express what one is thinking and feeling, even when it is really hard. There's a lot of stigma on seeking behavioral health care, and often people don't know how to access care or what treatment options are available.
Well, that's where you kind of come in. So can you elaborate on what services your program offers and maybe how someone would know if they would be eligible for the program?
Yeah, so folks can certainly contact us at 319-385-6552. And what we start out with is just a conversation, answering any questions and really explaining what our program is all about. And from there, if a person is interested, one of our staff members from our program can provide a confidential assessment to determine if you or a loved one or another person of concern might be eligible for the program. And our services here at Henry County Health Center's Senior Life Solutions, it includes that confidential comprehensive assessment. When a person joins our program, we provide a combination of group and individual therapy, medication education and management, and we also do aftercare planning, where we continue to engage and support our participants after they've gone through our program. And even though this is a group setting, we do address each person individually based on their needs.
Can you dive in a little bit and tell me more about what is group therapy?
Sure. So here at Senior Life Solutions, our group therapy, it's typically 7 to 10 people in a group, and you receive that group therapy to help work towards improved mental health and well-being. We really get into having group members help each other by sharing their personal experiences and strengths, and it's facilitated by myself as a trained therapist to really help members be able to have more open and explorative conversations around the various things that they may be going through. Again, going back to those difficult life transitions, this loss of a loved one, going through a recent medical diagnosis, the loss of independence. And by going through that process with others that might have similar challenges, it really offers the opportunity to build meaningful relationships with other people and learn and grow together in how to walk through those transitions.
How do referrals work with Senior Life Solutions?
Great question. Anyone can make a referral to our program. People can self-refer. They can talk to their primary care doctor or specialist, a family member, friend, community groups, nursing homes. If there's someone that you care about or are concerned with, tell them a little bit about us. Feel free to give us a call yourself or give our phone number to them. We really make the process as easy as possible.
Well, Chris, I want to say thank you so much for all the work that you're doing and all the services that Senior Life Solutions is providing to the community. We started this off by talking about September being Suicide Prevention and Awareness Month. So what is and how is Henry County Health Center Senior Life Solutions helping to build awareness about suicide prevention in our community?
Yep. Again, I just want to thank you very much for having us. We're really committed to trying to provide excellent care, and we're invested in our community here. We want to be able to provide answers to any questions people may have. We're certainly here to provide, different outreach efforts, education in our community. We provide education to other healthcare professionals about the signs and symptoms of suicide. We're certainly happy to come in and give any sort of community talks at local groups, again, about those suicide warning signs and prevention steps that people can take. And we also have a couple of different tables that we're going to have set up here at the hospital with various information on them. So if you're stopping in for any sort of service here at the hospital, please feel free to take a look at those during the month of September. And like I said, if you have any questions, give us a call. I really come back to it's all about having that open conversation, even when it's a difficult one.
Yeah, Chris, and I think, again, that national number, that 988 for the suicide hotline, such a good resource to have when, you might be in the middle of a crisis, to have somebody right away on the phone.
Absolutely. And that number, again, it's available 24/7. You're connected to a trained counselor that can really help. And always feel free to give us a call. We're here Monday through Friday from 8 to 4:30. And again, Senior Life Solutions, you can reach us at 319-385-6552.
Awesome. Chris Betsworth with the Henry County Health Center Senior Life Solutions Program. Thanks for coming on today to talk about Suicide Prevention and Awareness Month here in the month of September.
Thank you so much for having me.